आगे बढ़ते हैं। भारत को बड़े पैमाने पर खून की आपूर्ति में कमी का सामना करना पड़ सकता है। कोरोना महामारी की वजह से रक्तदान में देश भर में भारी कमी आई है और आंकड़ों से ये भी मालूम पड़ता है कि देश भर में रक्तदान में किस तरह से गिरावट दर्ज की जा रही है। कर्नाटक की बात करें तो यहाँ पर रक्तदान का आंकड़ा 50,000 यूनिट से घटकर दिसंबर के महीने में 11,000 यूनिट्स तक पहुंच गया और ये अगले 5 से 6 दिनों में खत्म भी हो सकता है। और ये भी बता दें आपको कि कोरोना महामारी से पहले मार्च के महीने में मुंबई में 21,000 यूनिट ब्लड दान किया जाता था। वहीं नवंबर में यह आंकड़ा गिरकर 10,408 रह गया है। आपको बता दें कि जिस तरीके की ये ब्लड डोनेशन की कमी देखने को मिल रही है, उस पर महाराष्ट्र के स्वास्थ्य मंत्री राजेश टोपे ने भी अपनी प्रतिक्रिया दी है। महाराष्ट्र के स्वास्थ्य मंत्री राजेश टोपे ने आम जनता, सामाजिक संस्थाओं और पार्टियों से रक्तदान करने की अपील की थी और महाराष्ट्र सरकार की ये अपील ऐसे समय में आई है जब लॉकडाउन में रक्तदान बुरी तरह से प्रभावित है। ब्लड की कमी पर बोलते हुए टोपे ने कहा था कि इसकी वजह से कोविड के मरीजों को परेशानियों का सामना करना पड़ सकता है।
ब्लड का आज शॉर्टेज है क्योंकि एसबीटीसी जो है उन्होंने बहुत क्लियरली कहा है कि 5 दिन का ही ब्लड स्टॉक है। रोज़ का यूटिलाइजेशन 3,000 यूनिट्स रोज़ का यूटिलाइजेशन है। अभी हमने सभी खुला करने के वजह से एक्सीडेंट्स भी हो रहे हैं, ऑपरेशंस भी शेड्यूल्ड हो रहे हैं, उसके लिए ब्लड लग रहा है। मैं अपील करूंगा सब लोगों ने ब्लड डोनेशन करना बहुत बहुत ज़रूरी है।
और हमारे खास शो दी अर्बन डिबेट में मेरा नाव ने इस मुद्दे पर एक्सपर्ट से भी बातचीत करके ये जानने की कोशिश की कि ब्लड डोनेशन में हो रही कमी की समस्या कितनी गंभीर है और इसका कैसा असर हो सकता है। आप भी सुनिए।
Suryaprabha, the other aspect is that, like Dr. Amita pointed out, that we are already on a year-to-year basis struggling to meet the requirements, and the pandemic obviously has just worsened it.
Absolutely agree with you, Tanvi. And I think there are two key fundamental challenges that have, traditionally restricted blood availability and adequacy in India, right? So, firstly, it's the blood transfusion service in India itself, which is pretty unorganized and fragmented. And as a result of which, there is limited or almost like negligible connectivity and communication between the blood banks, and each operates in almost near isolation, right? So, this leads to inefficiency in terms of catchment, demand, and supply, and consequently the availability as well as the quality of blood. And often, opening more blood banks is pegged as the easiest solution to address some of the complex problems of access. But in reality, shortfall of blood is because of the inefficiencies between the blood banks that I just mentioned about. And secondly, and more importantly, which we've all been talking about, and Dr. Mahajan touched upon it, that there is a cultural apathy of donating as directed in India, right? Even the most educated people perceive blood donation to be an emergency service. When you ask somebody, they'll say, okay, I'll donate blood. But we don't kind of take it upon us as an altruistic measure to go and donate blood when we are healthy individuals, right? And of course, there is also the problem of widespread misinformation and ignorance about the effect, importance of safety around voluntary blood donation itself. So I think these are important factors that we need to address as we move forward.
Okay, in fact, I want to also bring in Mr. Amal Patnaik. Mr. Patnaik, I read one of the exhaustive articles that you wrote about this issue as well, and it's honestly, it's not obviously limited to one state or two. It's across the country that we're looking at this situation. Now, how do we collectively step it up? Because it's not a regular time. We need to really increase, our blood donation drives at this point.
Yeah. We have gone through that article. Actually, I talk about a very innovative approach that our party followed. See, I look at it this way. There are 3 stages. One is the identification. The other one is the storage. The other one is again collection, and then transmission. These are the 4 aspects of. I would broadly put it this way. So even though we have a potential of about 500 million, we are just collecting from just even less than half. And the gap is, that's why. So identification is an issue. And the second one is the collection and storage and collection. So what we did, this identification aspect, as a political party, BJD, In April 2020, that's the first lockdown and the second lockdown was announced. The Honorable Chief Minister of Orissa we realized that thalassemia patients, for example, they are continuously having a problem. And then we realized that there is a dip which is going to happen. So Honorable CM made an announcement to all party cadres that there should be no shortage of blood in the state. And then followed it up during his birthday in October. We made a campaign, huge campaign. By that time, the unlock had come. So a huge campaign, and 10,000 units were collected, I think, in 1 week. And our party cadres did it at the, to take care of this identification issue. We did it at the panchayat level also, and by coordinating with the Red Cross authorities as well as the Rotary. So I think if there is a political will that is built into this, and given the young population that we have, actually one can't really complain that we don't have donors. It's just that awareness is one, and second is access issues. We should be able to, and it is very important we reach it.